This is our group presentation on the support for families of those with substance abuse disorders in America by Lauren Baker, Mariana Guzman-Pena, and Jessica Dorsey. We put a slide here to define substance use disorders. Substance use disorders are a pattern of symptoms resulting from the use of substance that you can take despite experiencing problems as a result. The DSM-5 identifies 10 classes of drugs associated to substance abuse and addiction disorders. The criteria for substance use disorders comes from the DSM-5. Some of them include wanting to cut down or stop using the substance but not managing to, giving up important social, occupational, recreational activities because of the substance abuse, using substance abuse again and again even when it puts you in danger, development of withdrawal symptoms, which can be relieved by taking more of this, the substance, and continuing to use even when you know you have a physical or psychological problem that could have been caused or made worse by the substance. In 2013, 6.6% of American population was dependent on alcohol or had difficulties relating to alcohol use, while more than 24 million people had abused an illicit drug in the prior month, says the National Institute of Drug Abuse. So if we think about 6.6% of the American population, we can only imagine that if each of those people has a family or a loved one that takes care of them or is in any sort of relation with that person, that they're somehow affected by this person's disorder. In a study on non-institutionalized adults, it is reported that the number of adults over 50 with substance use disorder is expected to double from 2.8 million annual average in 2002 to 2006 to 5.7 million in 2020. So that just goes to show that the number of adults in families or with these caretakers or any sort of relationship is continually growing in America. So some of the common issues that we found among families with those with substance use disorders are them not acknowledging the problem and being in denial of the problem, not having the appropriate knowledge of the disorder or how they can help, not being able or knowing how to start a conversation with the individual with the disorder, not being willing to address the problem, not being able to recognize what the Organization of Addictions and Recovery call the 3 C's, which are you didn't cause the problem, you can't control the problem, and you can't cure the problem. They may not have a support system for their own or for the others that can understand, relate, or are willing to listen. They don't have the knowledge of resources available to themselves or to the individual that's struggling, or even know where to find those resources. And lastly, they may not even have access to those resources. So locations, may not be within near these individuals. They may not have transportation, and they may not have the financial means to these resources. Substance use disorder is highly comorbid with other disorders. In one study, it was found that nearly a third of patients with major depressive disorder also have substance use disorders. And there's a higher risk of suicide and greater social and personal impairment. In another study that we found, psychiatric disorders were associated with increased severity of these substance use disorders, and substance dependence disorders were associated with increased severity of anxiety disorders. In a third study that we used in our research, the researchers interviewed 15 families, and they concluded that most families experience significant trauma, including childhood trauma, domestic violence, incarceration, family separation connected to substance use that challenged family communication and parental guilt related to past substance use and difficulty communicating about a past trauma. So here are the goals that we would have for family group therapy. It would be to increase the ability to discuss feelings related to a family member's disorder, decreased feelings of isolation caused by living with someone or supporting someone who has a substance use disorder, developing coping skills that will help support themselves and other members of the family, including the individual that's suffering from the substance use disorder, and addressing issues of codependency, enabling, and shame as they arise. The characteristics of the group members that will be in our substance use disorder family therapy would be adults ages 24 and over who currently live with or are supporting a family member with a substance use disorder. There'll be 8 to 10 people in the group, voluntary members who have participated in a pre-screening interview to assess their motivation, their understanding of the group goals that we have developed, and the likelihood that the member will benefit from the group, so it'll be mutually beneficial. So the group will be made up of various races, socioeconomic statuses, genders, and religions, and caution will be exercised when we admit members who may be in a vulnerable state of a crisis that group work may be harmful to. The way we'll recruit people for our family therapy will be through private practice or therapy referrals, substance abuse treatment center referrals, and local area businesses via employee assistance programs and referrals through those programs as well. In order to meet the members' needs in this family group therapy, family members will be assisted with coping skills, effective coping skills due to the daily stress of living and caring for a loved one with a substance use disorder. Family members often feel isolated, so this group will also assist in making them feel more connected, and will help guide them in how they can play an important role in their loved one's recovery process and mitigate the effects of living with a person struggling with a substance use disorder. So the group leaders in this substance use for family therapy will use the stress, strain, and coping support model, also known as the 5-step method. We've included this figure here so you can kind of see the 5 different steps that are included, and we'll go over more of those 5 steps when we present the group therapy model. This model supports the view that family members did not cause the addiction, and they're living with a person who has a substance use disorder. They may experience high levels of stress and strain that may impact their physical and mental health. Group members will focus on the central theme of how to respond to a family member's substance use. This goes beyond the explicit coping strategies, which will be covered in our next presentation, but also includes the ways of understanding and responding productively. And through the group process, members will receive quality support, which is the final element of the model.
So the reason why we decided to focus on families in general is really the idea that we need to recognize that even families that are functioning in various different ways, they also need outside sources and support groups for them to reach their fullest potential as just individual people, and then also as an entire unit. So families are so much more than just groups of people who share the same genes or the same address. They are a source of love and support within the group. And as regular families they go through conflicts and just different types of illnesses and disabilities and addiction in this case. And so all of these things work together to understand the capacity that even individuals are able to do, regardless of like their age or their gender or anything like that. But really, essentially, the benefits of family therapy in and of itself can be summarized in several different points. One is to understand how their family functions. So aside from just having regular conversations, this group therapy really helps to understand how the family works together as a unit. It also allows for family members to identify strengths and weaknesses within the family system. So understanding that one person's strength is not necessarily somebody else's strength as well. It also helps to set goals and develop strategies to resolve any challenges. In this case, with substance abuse disorders, it improves communication skills and overall just makes the entire family just stronger as a unit. Within the research that we found, we wanted to really focus on evidence-based practice. And the beginning of trying to figure out what approach we wanted to participate in, we really started off being rooted in research in and of itself. We really wanted to find what exactly worked best and in a very efficient way for families who have family members dealing with substance abuse disorders. Towards the beginning of the research, we thought of just commonly known approaches that could potentially improve and better support families of those with this disorder. However, between researching and just a couple conversations, we found that the stress strain coping support model was one that would better support the goals and principles that we initially intended for this research to advocate for, and has been proven to work in the past. It became clear that a stress strain coping support model would be the sort of intervention that over time would be most effective in establishing positive environments within the individual family units. The evidence that we found to support a proposal or our idea for this research is really emphasize the following ideas. So the importance of active and effective communication. As social workers, it's important to look for resources and evidence that shows that same individuals who are receiving the services, whether it's therapy or some sort of group, they can be able to walk away with so much more than just an intervention or just a way for them to live a better life. They should walk away with skills and important lessons to continue on towards the end of the termination process after therapy. It also advocated to understand clients' members participating in the research. The research that we found wasn't shy to highlight and emphasize macro and micro generational factors inside of the family system. It focused on the importance of mental health and how it impacts families as a whole. And it also highlighted the importance of gradual growth and the development of coping skills within the family. And so finding those different research really emphasized the importance of evidence-based practice, and we really looked for resources that were proven to work specifically within this community. So that is it for our project. If you guys have any questions, please feel free to reach out to us. You see the references pages are on there. Thank you guys so much.
Thank you.